Thank you. Ms. Barron.
Thank you, Chairman Collins, Ranking Member Senator McCaskill, and distinguished members of the Special Senate Committee on Aging. Thank you for this opportunity to highlight a program that extends and improves time at home for families who are caring for someone with Alzheimer's, dementia, or cognitive impairment. My name, as you know, is Lisa Barron, and I am honored to be here today. I'm honored to lead and to have founded Memory Care Home Solutions. We all know that we are facing an incredible national crisis with Alzheimer's disease, and that there is an incredible need to find a cure by 2025. However, it is also important to recognize the work that can be done today to help the 15.9 million unpaid dementia caregivers who are at home right now. So I am here to talk about a bright spot, a ray of sunshine in what is a very dark landscape in Alzheimer's. I founded Memory Care Home Solutions 16 years ago, also as a result of my family experience. Now, Memory Care Home Solutions particularly serves low-income families. 54% of the people we serve have an annual income of $20,000 or less. And because of generous foundations, corporations, donors, the state, we are able to provide this service free of charge. My mother-in-law, Betty Barron, whose children are behind me, began experiencing signs of Alzheimer's disease in 1997. Our family was blessed with educational and financial resources, yet nothing prepared us for the nightmare of Alzheimer's disease. And we can only imagine what families all over are dealing with and what their challenges are. For our family, ultimately, we were most concerned with my father-in-law. Was he eating enough? Was he sleeping enough? Was he isolated? My in-laws lived in a wooded area in St. Louis. And one night, my father-in-law was very busy making dinner, and Betty just left the house undetected. After a really traumatic night and a lot of searching, the fire department found her. She had fallen into the bottom of a window well, and miraculously, she was totally unscathed. But it was really at that moment that I knew that I had to help other families who are facing the destruction of Alzheimer's disease. And that's totally what Memory Care Home Solutions does. It helps prevent these sorts of family crises. I didn't know exactly where to turn, so I turned to Washington University and the Alzheimer's Night Research Center. And they directed me to the profound body of evidence on proven interventions to help families like ours. But I must say that I was really stunned to learn that there is no coherent, organized system to help families with behavioral interventions in their home now. And so our professionals went to work building on this evidence to make a community-based intervention for families facing dementia. I highlight this connection between research and between community health because if it wasn't for your generosity, for your prioritizing of this incredibly important issue on a federal level, we would not have a base of knowledge from which to develop our program, nor would we have the National Alzheimer's Protection Act, which specifically calls for, among many other things, expanding supports for people with Alzheimer's and their families. Yes, we need a cure, but yes, we also need to get proven interventions into the hands of the families who are caring for these 5.4 million people right now. Our program is a model, and it can be expanded and replicated throughout the United States. With Memory Care Home Solutions, social workers and occupational therapists from our staff go directly into the homes. They uncover issues that the family is dealing with. They teach them behavioral strategies. They set them up, whether it's in the bathrooms, the kitchens, wherever. They practice techniques with them. They practice transferring with them. They set families up for success. We also educate families on many sort of Alzheimer's complications, like urinary tract infections, or bed sores, or falls, or dehydration. This focus not only helps the families, of course, and the patients, but it also saves billions of dollars. In 2015, as has already been mentioned, the national estimated cost for Alzheimer's and related dementia reached $236 billion annually. We know that up to half of older adults who have some form of dementia make at least one visit to the emergency department annually. Of those, 40% are ultimately admitted to the hospital, often for stabilization or due to comorbidities, and of those that are discharged, 58% return within 30 days. This is an incredible cycle that really underscores the need for family education. Memory Care Home Solutions intervention results in a two-thirds reduction, an average of a two-thirds reduction in 911 calls, emergency department visits, and readmissions. Programs like ours create a win-win. There's a significant increase in quality of life, and there's also a significant decrease in costs. 91% of the people who remain in our program with us also remain at home in the community. In Missouri alone, this piece alone of remaining at home rather than being prematurely institutionalized translates into a cost savings of over $30 million. Unfortunately, most families across our state don't have access to this type of care, and I urge the committee to allocate funding and resources to equip all families in the United States with effective non-pharmacological forms of treatment for those with dementia. I'd like to close now with a quote from Dr. Kavinsky of UCSF, cited in the Administration on Aging's white paper. Quote, "If these interventions were drugs, it's hard to believe that they would not be on the fast track to approval. The magnitude of benefit and quality of evidence supporting these interventions considerably exceed those of currently approved pharmacological therapy for dementia," close quote. I thank you for this incredible opportunity. It's really been an honor to be here. And I urge you to think about the families of those with Alzheimer's who are in desperate need of all of our help. Thank you.
Thank you very much for your excellent testimony. Thank you. Thank you. Dr. Peter.